Free Zone podcast, what we do is we try as much as possible to have conversations related to social issues, personal issues, relationship issues, and anything pertaining our lifestyle as humans. Even though we can have one but show and there are people with expertise, not because they went to school to learn alone, but they have practically met situation that we are going to talk about. And see, in there, you know, I experienced the Free Zone podcast on several times, but in there, we are shifting to somewhere that is very important. I would say emotional and more intellectual when it comes to life. We are going to talk about something very important. So if you're watching us here on the Free Zone podcast, I don't want you to tune off from this channel. Just stay glued to the conversation. Learn a thing or two for yourself and people around you. I go by the name Kofi Jesse, and this show is proudly brought to you by Cape Store. Like a Cape Store, they are the biggest online platform right now here in Central Region. Anything that you want to buy, when I say Central Region, I'm saying the originators are from Central Region. But wherever you are in the world, when you go to that platform, www.capestore.com, Cape was spelled Kape, so not CA, Kape, capestore.com. And if you are ready to be, you just go there, you go search for it. When you get it, you place your order. If you have something that you want to sell as well, you go onto the platform as a seller, you put your cameras, you put anything that you want to sell there, being it new in box or slightly used. All you need to do is just identify the position of the item that you want to sell, and somebody will buy it. Sure, you understand. So we are putting, I don't know how we are going to go about it. I mean, we have this unique formula. So the funny, say spiritual, say physical, say biological. We're going to talk about it. Good evening.
Good evening,
How are you
Kofi.
doing?
I'm okay.
It's been a long coming for this conversation.
Yeah, it was worth it. So
Yeah. Thank you so much for even coming on board, because the whole team, the production team, including my programs manager, we've been looking forward to get somebody who will take us through this conversation.
Okay.
Anyone.
yeah, I'm happy to be here.
Welcome. This is
Thank you.
Okay. So first of all, can you tell us a little bit about yourself, your name, and anything that you want my viewers to know?
About me, okay. So my name is Asia Lokenu Oklu, but then you can call me Salsia because that's the brand name I use. I was before just a professional teacher, but then I am now a special educator. I'm actually still in school doing my MPhil in special education. I'm in my second year at UEW. Yeah.
So initially, you mentioned of you were a professional teacher, but now you are a special educator or
Yeah.
nutritionist or something like that. What is the difference between these two?
So like being a doctor, like a general medical practitioner, and then going to specialize to become probably a pediatrician or a neurosurgeon, or it's just like that. So I was just a normal general education teacher, yes, but now I've specialized in teaching children with special needs.
And before we come to our main topic for the conversation
Yeah.
tonight, what pushed you to that level? Because going to school, being a professional teacher, that's what everybody know about. That's what we are used to in our
Yeah.
society. You go, you get your degree, or you get your diploma as a professional teacher. You move on, you are doing your thing.
Yeah.
What pushed you to go into that?
It was it was quite an experience anyway. So it was some ups and downs that happened in 2022 to 23 in my life when I lost my dad, and it was a lot. So to cut it short, I had to move from, I was at Commander Senior High School. I was teaching there. So I had to move to Accra. Being a secondary school teacher, I was qualified to teach in secondary school. I had to be in Accra. It wasn't because I wanted to, but because I had to. They didn't get a secondary school for me. I was taken to the basic school, and then I was teaching in JHS. That was where I met children. And then I realized that, okay, so they're actually kids. In the secondary school, you hardly meet such kids because they hardly transition to the secondary level, yes. So that was how I met them. And then I decided to know more about them, yeah.
So would you say the passing of daddy, moving from Commander to Accra, was a blessing in disguise for you?
Sure. So people actually were saying, in Efi secondary school, naturally was a JHS. So it was more like a demotion. And in GS, when you were moved from secondary level to, it's either you have committed a crime and you are being punished or something. But this was something I opted for because I didn't have a choice. I really didn't have a choice. I had to come down to take care of my mom. She was sick. Yes. So, but then I came and I was happy to be there. And then I met these people. They've always been people I love growing up. I had friends. I had a deaf friend. I had a friend with cerebral. Like I have people like that around me. So knowing that we can have such children not only in special schools, but then in mainstream school. And the sad thing is the one I had in my class, I couldn't identify her. I was unable to, yes. And it's one challenge, yes. It's one challenge that I'm sure almost all general education teachers go through. So I couldn't identify her. We have something we call PLC, Professional Learning Community. So one of our resource persons came to take us through. And that day, the topic was how to identify a child with special need. And then when he mentioned them, I was like, then I have a girl like that in my class. So I met him and I told him about it. And I was like, say, how can I know more about them? And he said, go to UW. They have a course like that. You can learn about them. And that's how come.
Wow. So I was there. She has zoomed us into the conversation today. Children with special needs. First of all, when we say a child with special needs, what are we talking about?
We are talking about a child with special needs, a child that is unable to do things, whether it's physically or cognitively, a child his age is supposed to do. So the child cannot crawl at the age a child is supposed to crawl. Then it should prompt you the child has a special need. A child is not able to walk we call something milestones. So crawling, walking. So when they are not able to achieve those milestones when they are supposed to, there's a delay, then there's a need for concern. Yes.
Because that's why I said today it's not going to be like question and answer, interaction. Personally, when I hear people saying kids or children with special needs, the only thing that was coming into my mind, children who are deaf, blind, or something like that. But I wasn't paying attention to the cognitive side of these things. It's about class, then you said, they are all paying attention, quiet. I feel like everybody's okay. There's no. But today you're going to take us
we have types. So we'll talk about the types.
So now you've gotten us to understand that you can say children with special needs. You're starting, and I'm very happy when we started from.
Yes.
Your age of her, so
I'm a fancy also.
We are fancy. Okay, so that from start to all call. So to one call every time now. It is one record all we are. So to one we are telling the follow here special attention. If you are the time of now a certain age to not over on 2 months. If you are Okasa, over the points that they can say on by you. This and more
are signs.
Yes. Okay. So let's go on. See, I want to Matthias, your cousin, or special, and I'm of more special needs. Science need in a hammer. Let's talk more about it. The latest, and that's for the infant stage.
Yes. So, because we started from children, so and most of these disabilities start from childhood. Most of them, because some of them are neuro issues, like when we say neuro, from the brain. Yes. So if the issue is from there, then the child's development itself is a problem. And if your development is a problem, it means that if Kofi na Amande, na Kofi is fine, na Amanya issues, probably her mother. So it's like we are moving to the courses already.
That's what we are jumping to, but let's go, because I want to know miss a day. Then my everything. I will be our one day. Young father, but very spiritual aspect. Rest of the physical and stuff like that. You don't hold them points here. I don't start it all here. And the reason why I ended up very fortunate, Facebook, I have a group on my job. So one lady came to the group and posted there. Our back, Kakaba Wow. But Obodo Bisa there, at the time, not on Obotum will go after it because the family kitchen on so there. What's the family groups now? The new the process here. It's not making how many last started.
Yeah.
See, our family the baby maybe a certain month, certain period or we are or don't casa or don't answer to. What can be the causes for all these things?
Yes. So the causes have also been categorized.
Okay.
So we have the prenatal state and cause, which is the before the child is even born, which is more of genetics. So what's the mother is her practices during pregnancy, if she's smoking, she's drinking, she's we do herbs a lot because before easy. What's it does it do? Or my friend and all that. Sometimes no does it do no papa, but the quantity na normal. A drip brony ne draw be at that stage down. But bibini is on them way processing at the door and a cap do. But my yarn will fear ya bubu, ya bubu na yano. Inti damone in quantity or ye ma awo, and as I oko mobia, it be friend. So as area who dream indirectly, a friend so dream. It be pano here that made dream. So area so that's one of the causes is that the mother's lifestyle during pregnancy. And they been so as it be a mammy no fame, trauma be it be an abusive marriage, no bro, wash our badge and gender be an elusuba. All these emotional they have their turn on the child. Another yar baby a mammy no yari, it too many infection be as a mother. Because the umbilical cord is joining you to the child. It is a yarba no zin to some extent. I'm found hospital for treatment. Now one what test no who the degree now when you da friend. I know of a woman whose child like onyin sanin waka pay you funin wo treaty a friend yar baby woni ye funu na wasani wapame na won kano time nso do wodo but na friend yar wo ye funum. So what they were treating, no was no wapam, no be fear, no but there time was. How many of our local people would want to go through that? You understand? Because young phone compo. You bet if you read the man. It be an a yerban wabur just them my area, but I will pay a fine. But our friend is no on entreaty. So orizina na wakudu na adwen no ho adwen no so kape adwen no control bibia adwen batire ma wonsa do ria time aso nanto sor mo mudo nto bodu no ontum ye diamonds am nyina because that's part of the brain we another way nya issue. Then there's the postnatal, another during birth inti awo akabesia time na maame o say menyinsan awo so awo na yinsan o ma me say awo yinsan awo kanen otwene ya awo kanen be ya na pa 4 otwene ya enyubre 6 anso orko ekwa wo ba fefe wo oba ye wo day nti twane kakra. Prolonged labor also has its own effect. Sometimes the child has disconnected from the umbilical cord. Oxygen doesn't get to the brain, it has its own issue. So all these things, so prolonged labor, and then during the childbirth itself, push, say mama na ye weak too much. I bona doctor na nurse say when you go theater. Oh, yen fie office can be a radar. You give birth, excuse me I'm not to say that having faith is wrong, but although like the Hebrew woman, if the Hebrew woman's style is not going to save your life, God wants to save your life using some other means. You understand? God created the Hebrews and he created the Jews as well. So if you cannot give birth as a Hebrew woman, give birth as another woman, you understand? But then we want to go the straight way into abre. Afrana sumpa abro. Oja huma unsido or whatever way. That cut of oxygen for a short while. You understand? The child's brain is lacking oxygen for a few seconds, and then it's affecting the child's. Then there's also the wrong use of forceps. The nurses try to help these mothers in distress when she's pushing in. It's not wrong, but sometimes nurses unbend them to that extent without any fault. It was an answer a friend so watching. A chinam could say a friend in nature a friend now. It was from birth that thing happened, but you will not know. So
We move from that. You continue from that. I can't hear. We pay attention to. Mary Kay young matters today. Most or the main cause now of this. One point that will affect, I don't know, is the brain.
yeah, most of them. That
Because-
is with one type of the disability. Yeah.
Because making a young day, a friend, so making my many actions, answer about that is many stages of pregnancy to affect a friend.
Yeah.
During time down, I wouldn't cast a work because I'm making your mamma will be able to look at it. I mean, some most in pay, we are trying to crack, see a hospital, but you are to war, that the whole day you did to try to crack with future crack. Then 2 hours time and Sanako, lead now to affect a family. Process now for everyone, no support to affect a family. Push, maybe a day, all these things affect a family. Then, one matter today, the process of mommy, the first day of opening his son, to the day of it's very important.
Yeah.
That period.
Yes.
Because emotionally, psychologically, physically, everything can affect the child.
Yes.
And that can even end in a family being that child with special needs. Beautiful. It's ACA causes. Before we come to other aspects of the education, any experiences with some kids like that, and then I will feel we actually, what do you mean? We are meeting.
Yes. I've interviewed a couple of parents in Winneba mostly. So the most prevalent stories I'm getting, let me put it that way. The most prevalent story is Mowanan. So I was coming there. Some of the courses go beyond that. Yes. Community courses, yes. So after there, our friend, breast milk. You are not giving the child breast milk. If the child is not getting enough breast milk for a day or two, the child starts changing color. Into a friend or jaundice. When they become yellow, we say that they are jaundice. So they have jaundice is one infection that transgresses to affect the child's organs, which can it moves very fast that before you know it, sometimes jaundice can be cured, but then it leaves the child with that thing. You understand? So the child will not be born with any disability, but as Bariazan Manenufunsu Omba. Some mothers are so reluctant. There, why are you so relaxed? What's uncle wow? A friend wenya. Or there yet I said the enya friend or there ebo mazin there or batna. It's very important. Enufunsune as bamanan, Obama watna. Enufunsunem ba in na on banin more many chances bane. Nutrients or chance maze ban Obama wa me. Okay. But ma oba other organs of the body obey fine na there. Ono ni ni chance no. Or wa inti try. There are foods you can eat, massaging the breast and all those things you can do to help the child to breastfeed. 1 year effort. Mothers are sometimes very reluctant with those things.
So, I would also be the devil's advocate on the side of the mothers. Make sure my food was there. And you don't feel my friend, a friend in G. My bread, my is a million.
Shan, because Bibi yana na asuzin oba da wara wodo. Inti imagine they kita eba 5 years edawa itru. Itumu nkogwa etanazi wogoma a friend na wonche no pa wonto. Them stories ni bi na maka show. Mothers no say na muko chima. Nde afrɛ no nti wase makita bosom nti One Thomas and Pobio. Obasi then way easy. Menyimfo pii we gungwa na eja amamfo na mba. Ebe he na ahwa wo ba. Nti at that time no wada ezi hye wutiri me dey. If anything happens to this child na aye ono onum bibi ye na ontum nsore onhwe no hu. Awa na nti hye. Ekwaniku a wobaka hye the express. Fogu ma wazu ma wona eduri. Fa hye na no nkyende ye ho eguma oba men. Ekada on try be a lazy baby. We have lazy as we have adults that are lazy. We have babies that are lazy. Or you lazy. We gunenu no memmen. I will need trends in here the oboko no be okay. Do it.
You need to find every means to get a friend baby need them
try in a few days.
Make sure that no matter what I did there your man. Try that man on make sure because play a vital role.
Yes. Yes. Ebi wo wa afrene no ho ado. Wa convulse, what's a sura aka.
Yeah.
Oyazi bi otas convulsion is one of the key causes of some of these disabilities. When you look at
I have experience of that. Someone young kwa afrene ho. It means say you know who wan so mu. And some people can you could have an implication of my sister being a special
yes.
Okay.
So not just once, but repeatedly. Nti bi wo wa say Sure Canada ma regalic pusafa yenitirim na nenyim. Ibi wo wa afran it's like the child is losing breath. Nti eye na sent no konuma obotum wa ababa. Wa abo but e china nso obaba. So that's recurring convulsion. It will affect the child's brain eventually. Even temperature that doesn't lead to convulsion, but the child keeps getting temperature or affect our friendly brain. Nti temperature for hospital. What's a papi binunku or you're fine there or you're fine but as a strand in there as a strand or kufo as a chin no sunny bay as a ye bu or cray but or sunny bay or cheddar there's an underline there's something causing the temperature. If I look hospital no one share no one work like they should treat that infection to control the temperature. All these things. Also, so like I was saying, so back to the parents' experiences. So I when 2 days. No, you know, hospital. What's our friend? Enya jaundice. When you know to light, I say, what be fee? No hold the door. And sure, no mammy so hospital ni ye. Into 1 year drew. Wa papa ya friend and sound. Na ne baby last afre de bia order fa akwa azubu fom mpa otumanchie no kwana nkahwe. So you realize that thing affected the child's brain and now the child has cerebral palsy. There was one woman, she's even a student at UEW. Her child is I think 11 or 10. He had malaria at age 5. So he was a normal child until age 5. No year. So that's extreme temperature. I find no to no beefy and then is cerebral palsy child. Yes. So some of these things on ye be an or you have to understand there. Okay, heat and temperature and back. I find 1 year, she and yet no bear. Oh no, able to actually fearful. I don't have a problem with it. But since I'm American, who be there. Or I wanna it's no man zama wrong. You understand?
Working going beyond or outside the box to think larger. Meaning that children like this, you come to how to take care of them. Because now we've seen what we say is children with special needs and that's as for most of the courses they can have majority of them from do you an lifestyle putting so on the sun to affect our family during the birth of our family. I will kind of them or coming and also more than to 10 miles and 5 miles. Then the money to affect our family. Then we come to what would you feel on the Cassiano? I found 2 million food. So found I started on Kobo at day 1, day 2, and I will be all these things affect. Then the last experience for about 5 years.
There are people older, people who are 14, 15, man, when disability. Yeah. These are even the developmental ones. So, but one thing, let me clear the misconception on the courses. So these courses I've mentioned are courses that cut across all of the disabilities. But then when we take individual disabilities, there are further courses to individual disabilities. As if we were, of course, as wayerba, on to affect a new wayerba, na the cerebral palsy and autism. Onunka, these ones I have mentioned. So these ones are generally cutting across all of the disabilities, yes. But other things pertaining to specific disabilities, yeah.
And we didn't go to the specific disabilities, but now we want to look at the general aspects. We don't draw down because look at the end of the coming continuously because we educate parents in general. Because this topic, we move the general to the point that because
it's not easy, but when you look at my clients, most of them are mothers. Yeah. Wow. I can get mothers. I don't think I have any father that I can.
I feel like fathers would leave the burden on the mothers at a point. So I want to want this experience more, but and also so you can see that this one is happening to you. But before that, let's go to taking care of these kids. We are looking at the general aspects of it. Let's fly into this specialty. My share TV are doing children with autism.
Yeah.
Cerebral palsy. And sometimes as the stress the parents go through. Charlie, aside
stigmatization.
One can some emotional stress. Family, sometimes families even what you want now, but like this. You being someone learning and a teacher, how difficult it is. So let's use your experience from the day you found out that a collaborative class. How was it like? Taking care of somebody
like that. Well, they need extra attention.
And do you have that for kids like that in Ghanaian schools?
Yes, so what you need actually is empathy. If you sympathize with them, it will be very difficult for you to help them. The moment you are sympathizing with them, you want to cry with them rather than wanting to help them. So if what you need is empathy, you feel their pain and then you want to try and help them overcome it. And so that is what we like as special educators. Even when we are counseling parents, we tell them, I know a lot of people sympathize with these special needs kids. They don't need sympathy. They need empathy.
Not sympathy.
Yes. Empathy. They need empathy. So that as you are empathizing with them, you are trying to look for how to alleviate their worries. So this child I was talking about, she actually has a hearing loss in my class. I teach mathematics. So you can imagine. And then my class, Jina Day, face day, my child. Then I see that my child is looking outside the classroom. And I'm like, sit upright, look forward. Not knowing, it is this ear that is Papa no. Inti na onye papa no se oye day na onti papa na akunechi so onti makasa ni papa so oye day ya said but I didn't know. You understand? So not identifying them in itself is a very big problem. Very big problem for we the teachers.
Before you continue, do we have mothers who have children like that and also identify the one more?
Yes, I think my last client also has a hearing loss. She wears hearing aid in both ears.
Okay.
Her mother also identified her at age 6. Yes.
Because no, I couldn't be saying I also know how. Because when you have a child, when you knowledge,
yes.
Yes. But
so that's mother is one example of what you are saying. Na mafra nanta ama niska koto de bra obaba na wato different thing. But she hasn't been observant enough to know there never no kasa papa until it started affecting her speech. The hearing loss has its own turn on their speech. So one day be what can the two say to on some papa. Their speech gets distorted because okasa on they don't hear what they say. Their speech gets distorted. So that child, her speech became distorted. And why they kasadam? So that was where the mother's attention. And then she had to, according to her, it was even one of her colleagues that told her, the Afrana Casino or your nurse one or your it's on hospital. It was too late, because at age 6, she has passed all the milestones. There was nothing that could have been done except giving her hearing aid to help her hear better. So that's it. Or they observant as a mother, as a parent, as even a neighbor, so that we can help. That's why I want to be doing the advocacy more. It's not about, okay, my family is how can we avoid having more of them? How can we avoid making it minimal? Today, you wouldn't tell me ye baby for one. Maybe an answer query papa. Maybe an a penant or side. So.
Let me listen to the question. But everything we take and ponders on me. I'm asking myself some question because I'm my education in uni. But I found myself after servicing in teaching field.
Yeah.
And there are some students in my class. One day, I was rather it's like when can they wash that day or I feel like they're not paying attention.
Yeah.
One writes and different at that age, class 6.
Yeah.
Extra funny do your show. I don't you're very slow.
Yeah.
You are a chumpa. I didn't know all show. It's like or your bed man. You'll be afraid that I could drink water. But you don't know.
Oh,
and
great.
The reason we said on the general education system, our teacher, you are looking at the points there. From around that, all the students will books will be behind. So when they actually listen to, I'm asking myself, could there be a child like that? Another child, could they be like, no, yes, special attention now?
Yeah.
I mean,
yeah.
Because you could be in the car, and teachers start to be in the car. Oh, the head is oh, you have now we tell mom. That's what they tell us. Not that we are special, but now we tell mom, I feel behind the girls. Then I'm asking myself, you are fortunate to have an you can even identify it at an early age.
Yeah.
When you step in class within a week, you can identify it. There are teachers who are not
privileged.
Yeah. I'm asking, how do we combat this? Because you can't force all of them to go to school and learn what they are learning.
Yes.
What are some of the tiny things are a step into even in the midst of your colleagues 2022, 24, 25? It's too much in the law. This is my friend. And that's special attention. You have to be able
to
What are some of the special things?
So one of them is like what my resource person came round to do, my SPED coordinator. So then the way I'm around during our PLC to teach us how to identify them. So it's just education. So not everyone is privy to going to school to further in all these things. But then those days were there. Something like teachers, something about warm of farmer. Then we can bring around resource persons who are experts in these things to help us help the children. And then there's also the policies implementation in our Inti why at what day ihu afrebidama refer them for assessment. Or from no classroom, they haven't been referred for assessment. And if the child hasn't been assessed, you don't know the particular help to give to the child. You understand? So it's up to our colleagues, the teachers, to try as much as possible to report such kids that they identify to the authorities for assessment.
So I'm asking this question. You being someone who is learning and learning for things, myself, someone watching. Someone might not even be a student, a teacher, a professional teacher, or you're just if you are somebody in the banking field, somebody in the other sectors of life. What are some of the little tips? Everyone will be there. So now my answer today, one good. There are still disadvantages to Cassette. More always, am I very sensitive to the point that masters may need more. Okay, I found the good age here, I need to start the all year. So we are pay. Then even like I will be ready to stay on the year. Which I'm going on. Now, but we know showing the if everything is okay. But say a new man can due to lack of knowledge, but perish. So without knowledge, we don't know a lot of things. So I'm asking them, can you give us a tip or two? I will make a question. Hey, I'm only good day or a day. Young kind of or special child with special needs, but attention needs to be paid. How will you know and see how we can help?
So there's something we call ABC.
ABC.
Yes, appearance, behavior, and complaints. So you look at the child's appearance. Some of the disabilities, we haven't yet talked about the types, but some of the disabilities are physical. You see and you know. Like a child has red eyes. You see, you know that this child has a problem with the eye. And then when it comes to behavior, children with ADHD, like you were saying, ADHD is attention deficit hyperactivity disorder. So a child that is not paying attention is in class, is doing everything just to distract his colleagues. He's just hyperactive. It is also a disability, it's a disorder that needs to be worked on with therapy. So this is a behavior that is B. So one, you are looking at the child's appearance. So you meet a child, some people are having Down syndrome babies. You know, we are one. We are one.
Yeah.
We are one for you. We are one. But our way we are one. Appearance, we are one. So you can prompt them because the fact that we are one. Onum pepepe or tinawa pepepe mpa onyina obenya issues. So what there when I started when you look hospital now boy. Sometimes it supplements the child will be taking to calm their nerves and all that. Behavior, in one friendly behavior be the way or autistic kids have that behavior issues. Their social interactions are very poor. Today, so you see the child's behavior, you should have a clue about. Then we have C, which is complaints. So the child is complaining to you. Maswa ahadin and the damsel session so why it be feeling big in report. Sometimes it is the inner ear that has developed an infection. When it is overlooked, it eats and everyone that from Naswan we perforate. When you have a perforated eardrum, you can't hear again. You understand? So BBI, ABC is something we should look out for.
There's one thing as every human being.
Yes.
That's the appearance,
behavior, and the complaints. It's a friend or complain. Don't sideline their complaints. Let be approachable so that they can tell you their complaints. In the Abia Yashi, Nazibitim had the Oboko sorry. Manka de I drink to manka a chino a serious thing now, uncle. So I a simple Yashi Oboko you. It's a china if it's something bigger. Oh, Mama share. Ashe, or something that needs a doctor's attention, and you know, go hospital or one share, and then we can keep some of these. Yes.
Once I'm making the party will come the party because I'm now a junior. When you bought the idea, saying we should go on this journey. It's going to be a long journey. It's going to be a pointer. We walk out and the podcast to be outside. We are talking about we bring the parents in. We are actually come around. Let's talk about all these things. I didn't imagine this today. My action in ABC. This is how we are going to because in the end, young can say, general.
Yeah.
Let's specialize in the young can this particular one because if they pick the general on viewers who watch, they will bring their comments for us to understand. Then we move individual to specific results. This will be a few 30 minutes. But I just you assume that And we feel the very task, like very sort of is the right thing that I'm consuming or understanding. And then in the human life, them special needs need effects and the causes out in the mind most of the time. From infancy to young adults in things be a position, you feel like it's normal, you pay attention to it. Or too quiet, no, let them neighbor. So making India, I found it so back as well. If you know who are normal, someone will that working at the age of 2, at the age of 3, if you know normal. And pay attention to it as it grows and as Nakaso will then I know so why it's the infections will go the man it's an even affect there's nothing you can do. And I'm a
so we have to distinguish between a disability and a disease.
Okay.
A disability is a lifelong something. It doesn't go away. Until what can they with disability, actually they were managed for life. The only disability I think is progressive is one neurodevelopmental disease they call something or a muscle disease beer. As the child grows, the muscles no continuously weak. With time and then it's progressive. Aside that, the rest they come and they are like that. It is a nice one on yet. So name or you're blind. Like a disability cannot be cured.
So special kids, especially children with special needs.
Yes,
is it a disability?
Yes, they have disabilities.
We
are managing them. Yes. Some of them, so it is a range of spectrum. Some of them have very profound ones that but some of them too have mild and moderately severe ones that they can be outdoored, able to educate one and let them mingle. You understand? So it's like that.
Okay. It's about when we see it earlier, first of all, our air conscious.
Yes.
Of it, nobody
and the degree is less.
Okay.
So it's in a range of spectrum. Yes. It can be less.
But in one in Tama.
No, but I find what to profound. No. I am very. And I'm sure I will for able to make wage because you yourself you are traumatized. You are going through a lot. So please, to everyone out there, we should support parents instead of avoiding them. Let's support them. And it's na car. Afrana ontumo nkwana onye de maame ne na waji seat na de opede ne banana na obeda wodo afrana na okwana na oyeye. So if somebody's child's leg is on your lap, it won't spoil anything. We beg you. You make the parents want to stay indoors and lock themselves up, and they die before their time. When their parents die and we bring these children to you too, you will not take care of them more, but accept them. Let them feel accepted so that they can go out and also live like normal human beings.
Today we spoke about the general aspects of children with special needs. We looked at some of the courses. What can I say with special needs on the I'm a new course. I'm a new from the stages of pregnancy to 9 months or after a woman. I'm a new part on early stages of the madness. You are 5 years old and take exam 5 years in the madness. I'm a young. Some of the things I had now, young school and I need to pay attention to the ABC. That is affirming appearance, behavior, the complaints of the man. So I follow school, KG to K3, if you're a man. What about your customer? See one who go on pay attention. Sometimes more can be very important. If you are making Madam, when you be asking by you to change, Madam will go. If you have to make it as soon as had it not work, Madam will try to put on share on with 2 months, but Madam, it's only to command. So, all these things make me feel like when in the moon today, there is one thing very important about parenting and schooling of your child. It is too much. parenting, and build relationship with one teacher.
Collaboration.
Collaboration, because it helps a lot.
Yes.
I'm able to coordinate
Yes.
how you can help.
Yeah.
Wow. Thank you so much for this conversation. And look at it, you'll be able to better do 10.
Yeah.
We put it out there on our all platforms, that is Facebook, Instagram, X, and even on TikTok, education.org. And I will pay attention to the comments coming. But you're saying, mommy, papa, nia, be a meeting in the same neighborhood. You have to do what them challenges and I didn't tell DBC. And now I approach him, we are all reacting to that. Just comment in the comment box because we haven't my lady come back again on this conversation. We're going to talk about the special ones and we're going to pick them one after the other. Then we talk about it. If you need to bring somebody in with me and you be here, you need the person in, we delve deep. And say, I feel this soon. Just comment. I will just make sure I will link your contact to my sister here. Not because you can some. You don't people who want to church or how to go about it. The right hospital to go because Ghana and Kasano, we are all going through challenges. Sometimes you walk into some hospital now for about welcome where you feel bad. So you want to know the exact place to go. Yeah, so we help you with all this. We are here on a course and we are here on a mission. We want to solve something. So before I make you this is your camera. Because you need to get it more. You outside UK, Canada, maybe also. This is how to go about it. This is how to pay attention to your kid as a priest. Just not to
They have a special child or just anyone?
They have a special child, anyone. You don't know a special child. You don't have special child, you know how to approach the parents and talk to them. It's your general advice to our food now.
So, yes, okay. So, to all parents out there, I was going to say mothers, but I want fathers to be involved in the parenting of all children. No discrimination. So, to all parents, please, yepawan chow. Nyinsen numu kapim de wobo awo kanwa. Sometimes it is not the fault of the mother. Let me not so that one feel there is a fault ni nyina to wando. Sometimes nurses na worry were at fault. Report them like ma won there nurse no wa ye wo bani day so that if there's any remedy a doctor no be ya ma then na obotum wa ye ma fo nkofie nkadado answer. Na yenhwe na as a doctor maybe a doctor ahwe wonde o se wo ba no wode ka ye scan bi na ezeba no hwe de azi so ya baza wa suspect bibi mpoto e kwa man kadado kaye na fabra na wonhwe no obobo wa wo ba. I think thank you.
We asked that when you're here on the Fusion podcast, I think we learned a lot from them. 40 minutes. Production 40 minutes. 40 minutes and above. I really enjoyed the conversation. The matter so the personal experience 50 minutes. So the experiences in the says answer number one. We have our social media, our Facebook, and our platform.
For them.
And now if you have our special contacts, we are kind of from in case of anything like that. And now even baby specific your hospital
no, so if here there you can contact me on WhatsApp 050 3467 331 050 3467 331.
No, Mrs. Kakamo, just call the line for your friend. Okay,
WhatsApp. I want to record the voice, and to type I record the voice and notes.
Yes. For some video that maybe special child special, but I don't have to call you now. Just send the voice. Fortunately, fancy what's a couple of 40. And I think I'm not going to cuss with you.
Yeah, I'm saying, chi, house. So,
that's all good. Yeah, it's our member can be a non type of family. Can you answer one more? We answer your 100%. Thank you so much for watching this conversation. We also asking the ladies doing Cape Store, the Peanuts Britain. Just go on their platforms on Facebook, on Instagram, on X, and even on our own platforms where you can see that there are pages to support the process of this. We will be asking them was sharing with the past one of children with special needs. Let's go with their mental skills, comment box in their photo. The action, you never can, the action, remember, or your future. It's not fact, I didn't look more than the future is for the kids, and their life is very important. Every minute of their life, be very careful with it and know how to live, encourage, and protect them as parents. We love you so much. I'm a Fusion Podcast. We are out.